Okay, y'all, good morning. Feeling a little bit off kilter this morning, so I'm going to go ahead and put you like that. I have to do this one in a weird way because my friend sent this to me on the main account. Remember that if you're going to send me questions, it needs to be on my secondary account, and I will post it here below in the comment or on the screen. I'll do something. You'll see what I mean. Anyway. It says, Dr. Mike, I kind of have a weird question. I saw my PCP today and I got the gut feeling that he didn't like the pain plan that I'm on, which consists of medications like Percocet and Lyrica. Ooh, scary. I don't think he's supportive of programs with these medications. You're probably right. He asked who my pain doctor is, who is prescribing them. What I need to be concerned that he will try and get a hold of my pain doctor and express his opinion. I'm not the one who violates anything with the contract with the pain doc, and I'm the one to use the medication exactly the way it's prescribed. I never ask for early refills and I haven't had any failed urine drug screens. I just get the feeling my PCP doesn't like that I'm on these meds. The pain plan I have is working, and I don't want anything to jeopardize it. I get so frustrated that people have to worry about this. You know, when the DEA meddles, you know, that's something that we should all worry about meddling. But as far as from one doctor to another, I'll get to that in a minute. Let me finish this. What does it say? In your opinion, is there anything I should be worried about regarding him jeopardizing my current plan with my current pain doctor? Scene. Okay. Now remember, y'all, send your questions. Actually, I don't know how I'm going to do it with TikTok. I guess YouTube. I guess on YouTube, you're just going to have to start putting questions below because I don't think you can message on YouTube. So if you have questions on YouTube, you can by all means drop a question below. Just understand that I already have a backlog at the moment, and I'll get to it as I'm able. But back to this. I don't really think so, and here's a couple of reasons why. One, it's considered very poor taste to contact a specialist and notify them that you're not happy with their plan of care. Most specialists are going to look at you and go, well, I'm the one prescribing, not you, so I guess you're going to be okay. You know, go away with your hurt feelings and so on and so forth. I will say that if he contacts your pain management provider, even if it's not successful, you need a new PCP. Let me say that again. If he actually does what you're worried he will do, A, I don't think it's going to make any difference, but B, it absolutely clearly indicates that he's willing to break patient trust. And if he's going to do it over something like this, you really don't want to trust him over things that are even more important. You need a new PCP if he pulls this. Now, if he's just being opinionated, you know, we all got buttholes. We all have opinions, okay? I wish he'd actually come out and have a candid conversation with you about his concerns. One of the things my patients love about me is that I never have haterade quietly. If I have a problem with you, you're going to know it. And I warn every single patient that I bring on service that I'm everybody's dad. And that if I think you're doing something stupid or that you're being a dumbass, that I won't find a more eloquent way to say it other than you're being a dumbass. Okay? It's part of the trust in the relationship. It's why my patients love me so much and why I get away with saying some really sus stuff sometimes. Okay? When you love people, when you genuinely love people, you can say some things, okay? But back to the issue at hand. I remember one time early in my practice, and I got some great advice from my business partner and medical cohort, Dr. Shia. And I had a guy who was going to the methadone clinic, and I was prescribing benzos, and I did my UDS, And it was chock full of stuff that he shouldn't be at if he's going to a methadone clinic. And I asked him, should I call the methadone clinic and let them know that he's off the rails? And he gave me some really good advice. He said, it is every provider's job to do their own due diligence, okay? And not to rely on other people. It is not worth breaking the patient's trust when, if they're doing their own due diligence, he's going to be caught anyway. If they're doing what they're supposed to be, he is not going to be able to fool the system very long. And it is not worth a patient relationship concern and a frivolous reporting of you to the medical board by breaking that patient trust, all in the name of warning a methadone clinic who tests them all the time anyway. You see what I'm saying? There are so many reasons for that primary to not make that call. I do think the reason why he asked you his name is so that he can basically disavow himself in the chart. If you go into his note, it probably says something. Patients on Percocet and Lyrica being managed by blank. DEA, don't come knocking on my door. This ain't my fault. I'm sure that he did that. I don't hate it. I don't even hate on that. I just do think, I wish he'd come out and just say what his beef is. That would make me happier. But you don't have to worry. That's the key thing. You don't have to worry. I really don't think. And if he contacts him, I'm going to say it one more time, get you a new PCP. Because that breaking of trust is not, it's not right. It's not acceptable. It is not okay. It's funny. The easiest word is the one I can't remember. It's not okay. I love y'all. No buts. Why is this thing